So what can a person do if their loved one is experiencing any of these issues? The first thing is to ask yourself whether your loved one is agreeing with you and cooperative that this actually is a psychiatric emergency. In that case, you have many options. The first option, of course, is to call the person's mental health practitioner and ask for guidance and advice. That is assuming the person already has contact with a physician or a treatment team, of course. If they do not, most cities and counties in the United States also have a crisis response team. These are trained professionals, many of them available 24/7, that are able to talk to somebody, including a family member if the person can't talk themselves, to discuss what are possible options for emergency treatment. And that can even sometimes include mobile health services that come to the patient to talk to them, as it exists in Baltimore City where I practice. There, of course, are also there's a national hotline for those that are having thoughts of suicidal ideation. The National Suicide Prevention Lifeline in the United States is open 24 hours a day, 7 days a week, and can connect with local crisis centers as well too. Their number is 1-800-273-TALK, T-A-L-K. That's 1-800-273-TALK, and that number should be used freely for anybody having thoughts about suicide, and crisis services can be provided or organized through that lifeline as well. If the patient is feeling very ill, agrees with you that this is serious, and doesn't feel like they could tolerate the time on the phone to talk to somebody or to get help from their psychiatrist or therapist, in a true emergency, they should consider coming to the emergency department, which is always open for any psychiatric emergency. So if you can convince a loved one to go because they're feeling so terrible that they want access to a physician immediately, then going to your local emergency room or calling 911 to help get that organized via ambulance is always prudent if the other resources are not amenable to the person that you care about that's suffering. In instances where the person that you care about doesn't agree that there is a problem, or maybe they are so agitated and upset that having a logical conversation with them or coming up with plans with them becomes very difficult to do, there are other processes by which a loved one can get a patient an emergency evaluation. These kinds of laws that exist in every state are different in every state. So it's very important to know for your own state what laws exist that allow a person to get an emergency evaluation even if they do not want one by a physician. In all 50 states, there are laws that allow a loved one, a family member, the patient's physician, the police, to be able to coordinate an emergency evaluation in an emergency room. And often that these laws dictate what is required to allow that to happen, and also how long the hold in the emergency room can be for observation. For example, in Maryland, that time is 30 hours, and the law states that a patient should be a danger to themselves or others due to a mental condition, and they can get an emergency evaluation in the ER. Sometimes that can be done by the person without any intervention by the court, and sometimes it cannot. For example, in Maryland, you can get what's called an emergency petition to be assessed and evaluated in an emergency room, and if it's filled out by the patient's physician or a licensed clinical social worker or a licensed therapist, counselor, then the patient would not have to go. The filing party would not have to go before a judge. Same thing with a police officer, could also bring a patient to the emergency room. Again, this is in Maryland, without the approval of the court. For family members and loved ones, they would have to go before a judge in Maryland and get the emergency petition heard by the court and then served by the police to bring the person into the emergency room. All of these things can be very confusing at a time of crisis and when emotions are high and you don't know what to do, and there is concern when the person may either purposely harm themselves or inadvertently harm themselves, or purposely or inadvertently harm someone else. in a true emergency such as these, there should be no hesitation to call 911 and seek help in the nearest emergency room. Once there's an emergency evaluation in the emergency room, steps can be taken to get your loved one help from there. And again, those also vary by state, but often include mechanisms by which a person can come into the hospital for further treatment. In times like these, it can seem very stressful, and the decision can be very difficult if you're the loved one, because you may be wondering, what if my loved one who's sick now will resent that I did all these things later on? And I just want to end this by saying that when someone is well, they will always look upon the people that helped them when they were ill, sometimes for making terrible and permanent decisions with fondness and knowing that they cared for them, because our illnesses are treatable, and these symptoms are treatable. Your loved one doesn't have to feel this way or be at this high risk if they were treated. And so the most important thing you should think about is getting your loved one the help that they need.